Hello and welcome to Psych Talks 2.0, Season 2, where we believe in listening, learning, and empowering. I'm your host today, Dr. Arshia here, and today we have a very special guest who holds special value to me actually. Uh, and I start to explain about him, I can list out a lot of his contributions to the system of homeopathy. First of all, he is a HOD professor in Sri Sai Ram Homeopathy Medical College, having a past teaching experience of 26 years. He is the director and chief consultant of at Dr. Nagendra's Homeo Clinic and has practicing at two branches in Chennai. Apart from this, he is the Best Doctor Awardee by Tamil Nadu Dr. MGR Medical University in the year 2012. He is the author of two books which are very useful for students to gain knowledge, which is Comprehensive Study of Organon and Introduction to Materia Medica. He is a member PhD Screening Committee in TNMGR Medical University. He has also presented seminars at various international platforms, and he has participated, conducted, and presented many papers in national and international platforms. So I warmly welcome you, Dr. Nagendra Babu, sir. It's a pleasure to have you here. Thank you for accepting the
Thank you, and
invite.
same to you. Thank you for having me here.
Yes, sir. It's a pleasure to have you here, actually. And with this, I would like to list out a few questions because this session today is in the view of World Health Day and World Homeopathy Day. So, having the two events in consideration, I have a few questions which we commonly encounter in our clinical practice so that the viewers here can gain insight about homeopathy and how it is related to the medical field. So, sir, the first question which we encounter is how actually homeopathy works. So, can you please explain this question for a better understanding so that a layman can understand how it actually works?
Initially, to start with, you coined me a tough question, right? So that is more controversy in homeopathy. Why homeopathy is not accepted all over the world? It is not for the theory. It is not for its approach. It is for how it works. Because it's a controversial subject. Like homeopathy deals with micro doses, right? Today we have a support from nanotechnology that homeopathy. I can take the quotation from Dr. J.S. Balla. You might have heard of him, and we called him for a seminar as a speaker to Sri Sai Ram Homeopathic Medical College. Also, he is a professor in Professor HOD of Pune University. Now I heard he got transferred to some other university. And he is doing research on pulsatilla, aurum metallicum. These are the two remedies on which he is doing research on how homeopathy works, right? It is the micro doses that gives the life to homeopathy. We call it as dynamization in 18th century language, but today we can call it as nanotechnology. The nanoparticles which the medicine contains, homeopathy medicine contains, it will have an effect. It is the nano effect that we induce on the patient, right? When it comes to traditional explanation, sticking to my own subject, homeopathy, we have a separate chapter in Aphorism number 28 and 29, modus operandi homeopathy cure. It is not the medicine like a conventional allopathy medicine which fight with the disease. For example, in antibiotics, if you take, the antibiotic chemical will go and kill the bacteria. Whereas in homeopathy, the medicine doesn't kill the bacteria. It will stimulate your immunity so that your immune defense cells, we have various cells, modifications of WBC, as even layperson can understand that, white blood corpuscles. And these ones, which will be get stimulated by homeopathic medicine, and in turn, the patient's body will fight, which in our homeopathy literature, we call it as the medicine acts on vital force. That means the fighting mechanism of the human body, we call it as immunity. So homeopathy medicine stimulates your immunity, and in turn, immunity will make you to free yourself from medicine. This is in a layman's simple terms I can explain. Yeah.
Yes. So, sir, Talking about today's scenario, many people come to us in a clinic, they Google it because they don't find the reliable resources for how homeopathy works. They come with a lot of taboo, calling it placebo. So, what is your take on this? How do you tackle this placebo taboo for homeopathy?
Homeopathy is not a placebo, right? So, a lot of things we can say. In 18th century, as far as history of medicine is concerned, homeopathy dates back to 18th century. And homeopathy is the one, Heinemann, the father of homeopathy, is the first person to fight against the rationalistic and against the ritualistic. We call it as empirical methods. Okay, you cannot believe in the experiences of other physicians. We have to believe in experiments on the medicines. So when it comes to homeopathic Metromedica, the pharmacology book of Metromedica, I can call it as, the Metromedica, each and every drug is proved on healthy human being. In the entire medical world, homeopathy is the only subject where no medicine is given to the patient without proving on healthy humans. So the birth of Metromedica itself is a science. The birth of the homeopathic Metromedica itself is an experimental medicine. So you cannot call it as a placebo, right? People who call homeopathy as a placebo, I invite them to one experiment. There is one medicine, famous medicine, everywhere it is available, sulfur 30 or sulfur 200. I asked whoever is calling homeopathy as a placebo to consume that medicine daily, only single dose for 15 days. And the so-called, what the people call as so-called sulfur placebo, will have an itching effect on the persons, right? And second thing I'll tell you, if you come across any patient or kids having abscess, adipatta piragu and the punnu varum, yeah. So abscess, I'll ask them to repeat Silesia 1N. I'm telling you specifically, I don't want to confuse the other people on homeopathy. Silesia 1M is available. Just give Silesia 4 times per day. And you can see the abscess bursting out without surgery. So placebo doesn't work. First point. Second point, homeopathy is not just the white pills. Homeopathy also contains mother tinctures. Mother tinctures also are accepted in homeopathy. I don't want to quote and confuse other people. Okay, mother tincture is a tincture where material dose can also be demonstrated. Example, Ravalfia serpentina, mother tincture is there, which is used against blood pressure without atherosclerotic changes. That means regular primary hypertension, you can use it. And the results will be very evident within 1 week. So you cannot just, strike out homeopathy as a placebo. And just now in the first question itself, I quoted, we have a support of Dr. J.S. Bellari, the professor of nanotechnology from Pune. So a lot of experiments are happening. So homeopathy is not a placebo. And I'll say, when it comes to experiments, even science experiments based on two aspects, in vitro study and in vivo study. In vitro study is the study where the live tissues will not take place. The experiment which is done in the test tubes, in vitro study, where the live tissues are not there. Whereas in vivo study is a study, for example, for the culture of virus. The virus is a substance or the living substance which cannot grow on non-living. It requires a living media for its development. So that is why you have live agars or chick embryos for the development of virus. So every homeopathy medicine is an in vivo study, I can say, because the human being themselves are the experiments. Guinea pigs are not there. Humans are guinea pigs in the development of homeopathic Metromedica. So I don't call it as a placebo. Yeah.
Totally agreed, sir. So, what according to you are the biggest challenges for homeopathic treatment?
Yeah. Yesterday I had an opportunity to celebrate Heinemann's birthday with the students and staff members of Bharani Homeopathic Medical College, E Road. I think there itself somebody raised the same question. See, why do we celebrate Heinemann's birthday as a World Homeopathic Day? There is no use of celebrating any festivals, right? The festivals come with an intention. They motivate you. Okay, they help you in introspection. Yeah, homeopathy, like other people, most of the people they call, sir, medicine has advanced by leaps and bounds. And homeopathy is a old medicine. How can it succeed in today's world? First of all, I would like to educate them. I'm using the word educate because homeopathy is not an old medicine. I call it as it is a newborn in the medical field. Majority of the Indians get confused that homeopathy is related to Siddha and Ayurveda. See, Siddha and Ayurveda, they call themselves as Sanadana. Sanadana means they don't know when it was born. It dates back to 5,000 or 10,000 years. Okay, we have Puranas in the background. Whereas homeopathy was born in 18th century, middle of the 18th century, and it was discovered by an allopathy doctor, Dr. Samuel Hahnemann, right? Today we are celebrating his birthday. So it was born in 18th century. Whereas modern medicine, which you call as modern medicine, actually date back to 4000 BC. The father of modern medicine is Hippocrates. So homeopathy is not a old system of medicine. It is a very newborn medicine. And in spite of that, homeopathy has grown within a short period of time. It is giving competition to allopathic system. Most of the allopathics also taking homeopathy today. And some 2 years back, NIH, National Institute of Health in London, they have conducted research, and according to them, homeopathy is the second largest growing medical system in the world. The success growth rate is 52% as far as new patients emerging from allopathy system to homeopathy. But in spite of all these things, the greatest question remains today with homeopathy is the research. I feel research, research, and research. Research is the only answer which can give evidences how homeopathy acts. What I request all the homeopaths all over the world is every year we should do SWOT analysis, like MBA people will do: strength, weakness, opportunity, and threat. The greatest strength of homeopathy is no side effects, easily palatable, right? Anyone can take it. Okay, another thing is it has a very good answer to.
Children love to come to homeopaths only because of the sweet pills.
Of course. People who don't like Siddha and Ayurveda because it contains kashayam, bitter medicine and all, they are shifting to homeopathy, right? Strength is a lot of strengths are there. And lifestyle disorders are growing in India as far as India is concerned. India is becoming American because we are adopting American lifestyle. So we have to pay penalty for that. So homeopathy is a great answer as far as lifestyle disorders concerned. These are strengths of homeopathy. Opportunity is, yes, when people are shifting to you, every shift is an opportunity. We should practically, clinically, we have to give answer to every problem that the patient comes to you with, whether it is acute, chronic, or challenging lifestyle disorders, psychiatry. Homeopathy, no doubt, has improved a lot. Today's newcomers are going for specialization, psychiatry, and all these things. And few of my students are doing well in infertility cases also. I'm very proud of them, and they're doing very well when it comes to infertility. And homeopathy, another plus point, is very economical when compared to other systems. And the greatest weakness, as you raise the question, we need a lot of research. We need evidence-based medicine, which no doubt we are doing it, because evidence is not just laboratory evidences, clinical evidences also we can produce. Testimonials can also be produced, and lab reports can be shown as a evidence that before and after. And visible, like when it comes to rheumatoid arthritis, the deformities, when it comes to psoriasis, the disappearance of the skin eruptions all over the body can be provided as a evidence. So it not be a laboratory evidence, right? And the government has supported CCRH for that. Central Council of Research in Homeopathy is doing good work for the past 50 years. And we are growing, right? The greatest threat, I can say, is practicing homeopathy. Most of the people should practice homeopathy. And as I said, I feel the greatest problem with homeopathy is the research. I stop there.
So, what are the cases which are best treated with homeopathy?
First and foremost, I say autoimmunity. Autoimmune disorders, every homeopath will agree all over the world that homeopathy is the only answer. After 26 years of experience and after 26 years of teaching with my own experience, I can say that there is one more book where allopathy fails, homeopathy works. I think many homeopaths would have gone through that book. See, when it comes to history, the father of Western medicine, Hippocrates himself will say, allopathy is a palliative medicine, no doubt about it. When it comes to emergencies, real emergencies, life-threatening problems like accidents, poisoning cases, homeopathy has a very limited scope to offer there. We need hospitalization, we need chemical antidotes, uh, we need help of surgeons and specialists over there. So OPD setup cannot help you. Most of the homeopaths we have OPD setup. But as I said, homeopathy is growing. I can recall two places for information sake to the participants. There is one clinic in, I can say, hospital setup in Calcutta, Dr. Banerjee Hospital. It's very famous there. Three generations have passed by. And Banerjee has a protocol methods in homeopathy. They have really done very well in cancerous cases also. And with evidence, they have shown blood reports and laboratory investigations, CT scanning, MRI, lot of evidences they have produced, and they have presented many papers in national international seminars. And their book is also available. You can Google it. Banerjee protocols. They have done really well. So homeopathy, no doubt, has shifted from its boundaries and scopes. It's expanding. Second one is down south in Kerala. There is one college attached hospital who are doing enormous work in controlling cancer. I think in my YouTube channel also I have put a video on that. I felt very proud about that. And one of my student in Chennai also, he started a hospital, homeopathy attached hospital, and I'm also proud about him. So we are growing actually, and the growth is the one which shows we are alive. We are growing. Right? Growth is life. So we are doing very well. Homeopaths are doing very well as far as India is concerned. And the greatest opportunity that we Indians have is government of India is supporting, and they have accepted us as a registered medical practitioner. This is not happening anywhere in the world, in any other country in the world. Yep. So homeopaths can answer from common cold to cancer. A concise answer to your word, because every homeopath accept all autoimmune disorders can be cured. I can use the word cure in homeopathy. No other medical system can cure.
Exactly. So, in this with this question, you have already answered, given answer to my next question. What are the limitations of homeopathy? Because both the things have been covered in this question. So, let me move on to the next question. How is homeopathy related to mental health?
Yeah, as I said, when it comes to WHO predictions after COVID, they've already predicted that after COVID, psychiatric problems and mental health will be disturbed after COVID because of various socio-economical factors. Some people have lost their business, some people have lost their jobs, some people have lost their entire families, got divorced. A lot of things have happened. And there are a lot of setbacks people are facing after COVID. And the medicine which has a psychiatric background, which can answer the mental illness, can really solve these problems of the people, social problems of the people. And homeopathy, no doubt, the father of homeopathy, is the first person I can say who cured, he claims to cure the Austrian princess from schizophrenia. Today, psychiatry says schizophrenia cannot be cured. It is clearly evident in our medical books, homeopathy medical books. If you go through the life history of Heinemann, Dr. Samuel Heinemann cured Austrian prince from schizophrenia. And we have another institution to claim, because I should not make false claims. I can give you evidence there. In Maharashtra, we have a Davle institution. Davle institution is specialized in psychiatry. In many seminars, I have even witnessed their cures they have achieved in psychiatric illness. And in Chennai also, one of my student, first batch student, he got his MD degree from ML Davle institution, and he started a psychiatric wing in his clinic in Chennai. As I said, I'm giving you evidences from my own students. Yes, we have. And second thing is homeopathy being a holistic system. The holistic system always covers mind and body, right? And homeopathy, in fact, believes that all the problems start from the mind. It is the vital force that first suffers, and the suffering of the vital force is reflecting on the body. So vital force, you can call it as a man's life and mind, his reaction to environment, right? There are two chapters. One is psychology, second one is sociology. I feel a homeopathic doctor is and should be well versed in psychology and sociology. Psychology is how a single man is suffering to the surrounding environment, his reaction to the stimulus, whereas sociology is a person's reaction to the people surrounding him. He is a unit in the society. Society is a collection of units. How he is reacting to it. Homeopathy beautifully trains a student right from first year to second year. Of course, Metamedica itself will teach you how a person is reacting to the environment. Example, love failure is the one incident, but different people will react to it differently. Phosphorus, a patient, reacts to love failure differently. Pulsatilla is a patient who reacts to love failure differently. Natramur is a patient who reacts to love failure differently. Naxomica reacts to the love failure differently. Medorinum patient reacts to the love failure differently. See how analytically in 18th century itself, homeopathy has created an environment for the study of psychiatry. So homeopathy, yes, can answer any psychiatric problem.
So, coming to the end of questions, we have already mentioned what we lack and what we have to surpass now. So, last piece of advice for the upcoming students of homeopathy: what are the areas that are to be focused in this system of homeopathy?
A piece of advice, yes, of course, practice homeopathy. First, the big piece of advice. Medical practice is a service, and homeopathy 100% does the service to you. I think medical practice is the only profession where you get everything you need, a person needs. If you concentrate on your patient, if you do the service properly, you don't worry about the comforts. Always I'll say, most of my final year students, when come out of the college after getting the degree, they have a fear. This fear has come, in my opinion, when they compare themselves with other technical students. The engineering students, after completing their BHM, after completing their engineering graduation, they directly join into MNC and their salary will be enormous and high for their age. Whereas homeopaths, they have started now. For them, I'll say, see, don't compare yourself with IT professionals or engineering people. Their graph will be like this. They'll have a good salary, they'll have a lifestyle, and they have a decline. Whereas a doctor's life starts like a ascending. You will have nothing, but you have everything to start. And gradually your patients, one satisfied patient will give you 5 patients. And these 5 satisfied patients will give you 10 patients each. Your growth will be like linear. Gradually you will go there. And another point is you don't have retirement. You are the boss. You are the boss. People will come to you. They'll respect you. You can take leave whenever you want. So there is a lot of flexibility. Initial stages, you will have to put your input, right? Don't look for the money. Money will flow to you. That is what the beauty of medical system. The only thing is you'll have to prepare your own ground. Basement stronger. Prepare your basement strong first. And who is your basement? Your knowledge, your patience, satisfaction of the patient. One of my senior doctor advised me when I was a youngster. I can take his name, doctor's name, Dr. Venkatraman. He told me, Nagendra, don't look for money. Okay. Just concentrate on your job. Your job will give you satisfaction. Give 100% your job. Ultimately, you are a doctor. It's a noble profession. Here you have to relieve the patient. Once you relieve, obviously they'll come to you. And be true to yourself. If any case is not handled by homeopathy, be open to them. This is out of scope of homeopathy. Please go to some other doctor. If it is out of scope of homeopathy, don't hesitate to refer to me a surgeon. This advice, Dr. Venkatraman said, and today, even today, I'm following it. And by all spheres, I am happy. So the only advice I'll give here is to youngsters, please stick on to homeopathy. As I said, homeopathy is growing, growing, growing. Don't leave that opportunity.
Sure. So that's the best thing we can suggest. With this, we have come to the end of session. Let me check if I have any more questions from the live chat. Okay, I think I've addressed all of them. So thank you once again, sir, for your precious time and your inputs. I think this will be a guiding light for people who are searching about homeopathy and even for the students who are looking into it. Uh, Thank you once again. With this, I'm
Thank
ending the
you.
session. This Dr. Ashia
Thank you,
here
ma'am.
signing
Thank you.
off. Yes, sir. Me, Dr. Ashia here signing off from Site Talks. Stay tuned.